welcome back. I'm your host, Michael Stamatinos. Welcome to the Advancing Healthcare Innovation Show. And if you guys are new to us, we're really pumped to have you here. We're really passionate around healthcare innovation, adoption, leadership, and creating more access. And if this is your first time tuning in, let me tell you just a little bit about what we do here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And what does that mean? That means that we talk to real people that are really innovating within the trenches and give them the platform, the opportunity to share their story. People tend to resonate more with stories, so that's what we try to do. We've got an incredibly action-packed year. We've got a bunch of amazing new content, new speakers that are lined up. And by the way, if you haven't checked out any of the historical interviews, make sure you hit subscribe now so you can get any new ones that are coming out right to you, as well as just geeking out and binge watching a number of the other interviews that we've done. So appreciate everyone checking in on that. And for those that haven't connected with our guest today, we have Dr. Matthew Tabakin, the CEO of Medsense Health. Dr. Tabakin, welcome to the show.
Hey, Michael. Thanks for having me.
All right, so let's just kind of dig in because we haven't done an in-depth introduction on you as a human being and sort of the genesis of Medsense Health. So maybe take us back because you're a clinician by trade. What was it that sort of prompted you to say, you know what, I'm going to kind of take this adjacent route within medicine and take the entrepreneurial road? What was that decision-making process like for you? Take us through that.
Yeah, so while I was in medical school, I really became passionate about kind of being able to pursue innovation, just not necessarily just clinically, but how could we make a big impact on the entire healthcare system as a whole, and really kind of looking at it as not only just as as a clinician, but how can we make a big impact as a business. And then during my second year, we had a class that was called Health Systems Management, and one of our kind of thesis of the class was to pick a big topic in healthcare and come up with a solution, figure out a new way to innovate in that space. How could it, save costs and improve outcomes? And that's when I stumbled upon just the massive issue of medication non-adherence. So from there, really kind of started my research and really digging down deep into kind of understanding the problem, really becoming an expert in that space. It was from there that it kind of piqued my interest after the first 2 years, which are really more focused on, learning all the basics about medicine from a science standpoint. And then the second 2 years are more taking that, basic knowledge that you have and let's learn how to apply that clinically. So during the next 2 years, I really kind of used what I'd learned from that course and that paper that I wrote to really kind of talk to real patients, get real understandings from different groups of patients, from the VA, from the emergency department, from outpatient clinics, to really trying to speak with a diverse patient population and try to understand the core reasons of medication non-adherence. And then ultimately from that is really where I was like, okay, I want to build a solution that helps all types of patients, regardless of age, experience with technology, or socioeconomic background, and really try to make a profound healthcare, not just clinically, but how can I deliver innovation to help, thousands and hundreds of thousands of patients? And that was really the kind of the genesis of Medsense Health.
Curious, I guess you spend the majority of your life kind of going through school. What did your parents think? What did your close friends think when you announced to them that, hey, I'm kind of going down this road? What was that like?
So I had spoken to my parents, have known me as always, like wanting to pursue kind of the intersection of both healthcare and business. It's been a kind of an interest for me to find the ways that I could provide value in both spaces. And then when I came to my parents with this idea, I think they were a little bit excited, also kind of scared, because as parents, they want you to succeed, and pursuing something with as much risk as entrepreneurship as a startup. The standard statistic is 1 of 10 startups fail. Is risky, and it can be a little bit terrifying, but I knew that the belief in just by, but belief in this desire of almost calling that I had to kind of bring this technology solution to market. And that drive was going to make the difference. I think that they became at peace with that decision. And it was really something internal in me that was just like, I needed to pursue this. When I spoke to my advisor, he thought I was absolutely crazy. Many of my clinical advisors thought I was absolutely nuts for basically saying, okay, after graduating med school, I'm going to go, move across the country and start this company called Medsense Health. But every day grinded hard, worked hard, made just kind of work towards that ultimate vision that we have, and kind of by always kind of driving down to the core thing of like, wanting to be able to help patients through technology has been able to, get us through all the challenges that we've, faced on a daily basis.
So you, what you just described there early on, when you're saying my advisors thought I was nuts, there's something that I call the look. When you look at someone and they give you that look, and you just know there is no way in hell I'm convincing them otherwise of what they want to do, and I'm just not going to get in their way. And I think we all have come across, sometimes you have advisors and maybe their intentions are good, but let's call it what it is. Maybe they're projecting onto you, maybe some of their fears, like, oh, you're crazy, this is the safe road. But having spoken and interviewed a number of different physician entrepreneurs, I can always say that the road less traveled has been more fulfilling. So it's cool to just sort of get to know you, especially on this journey as you're evolving and taking the next step.
Yep.
So talk me through, you make this decision, you decide to start the company. How do you formulate your team? Who do how do you kind of really sort of start to craft a solution? How long did you have to sit in the problem to really dig in and understand the problem before you decided that, like, all right, now we got to move towards solution? Talk us through
Yeah.
that.
So I spent 2 years during my clinical rotations, kind of using the end of the patient interview to maybe try to poke out some aspects related to, medication adherence, how they were doing, how they felt their challenges were, what type of solutions might be effective to them. And did it in a way where, again, when I was making sure I was asking a diverse patient population and kind of going home and recording those responses. It was at that point where, I obviously made the decision to kind of move across the country to where I went to medical school was Medical College of Wisconsin, where I met my wife, who is a pediatrician. So she matched at the Seattle Children's for her pediatric residency. So we moved out to here, and that's when I really hit the ground running for Medsense. So as someone coming from a healthcare background, I didn't have any, technical coding experience. I'd never, worked on building an application, let alone, an application that you're going to need to build to succeed in the healthcare space, where there's so much, security requirements. I mean, you need to build a top tier application to really, succeed in that space. So someone coming from a clinical background, that was definitely, I needed to find people that believed in the vision and had experience and knew what they were doing. So what that took was really going and started networking. So one of the good things about Seattle was there are a lot of startup, events here. So would sign up on Eventbrite and start just basically hit boots on the ground, going to meetings, starting to network, talking to people. And then that's when I found my second co-founder. His name's Clark Emmerich. He's got over 40 years of experience building devices. He patented one of the early 911 systems, and it's really kind of been the master architecture of our IoT platform, which again of our sensors, our hub, and our AI. Once we pretty much started to validate that core platform, I wanted to take our devices and really build more of an enterprise backend. So how can we build like a software platform where providers and clinicians can, monitor all those devices and then really use that data that we're collecting to empower, the patient to better control their chronic healthcare disease, but then also provide the clinician with the data that allows their job to be easier. And that's where we found Matthew Burrows, and he's, through just interviewing over 30, 40 different people, and finally found the right job. Again, having him be super passionate about himself. I mean, he has 5 or 6 family members using Medsense Health and benefiting from it. And it's been great having him on the team. And then it's kind of continued to snowball from there.
Yeah, I'm convinced good people know good people.
Yep.
So before we dig in more into this solution, let's talk about some of those conversations that you're having with patients, and what were some of the patterns that were surfacing? What were some of the biggest barriers, some of the biggest challenges that you noticed, maybe that surprised you initially? Anything that you can maybe comment on around that?
Yeah. So there are a couple patient conversations that I remember that really had a profound impact on me. One was when I was at the VA. I asked him, what kind of solution are you using to manage your medications? He's like, I'm not using a solution. And I was, asked him, what would be, what would be helpful to you? And he just said, one, he wanted to feel like someone was there providing support for him, knowing that he was being, watched over and look out for, and also a system that was able to communicate with him when when he needed to take a medication, to have a nudge or a reminder to help be able to take that promptly and effectively, and being able to kind of do that through the day. And he really felt like he was optimistic about the solution that I kind of presented to him at another time. Another really big impactful story for me was, I had a 55-year-old patient come in the emergency department. He actually ended up passing away due to aortic dissection, basically because he wasn't taking his blood pressure medications. His wife was an ICU nurse, so someone that's in healthcare, but he completely fell through the cracks. No one knew he wasn't taking his meds. Completely preventable use case. And it was there that it was just like, man, if we can build a system that can identify medication adherence, alert people of that, and also provide a tool that helps patients be more compliant, wouldn't that be a great thing? Couldn't we? I mean, that's just a proven, case of like saving lives. I mean, obviously the ED visit that probably cost was $40K, but I mean, and you can think about just cost savings for that. But I mean, really at its simplest thing, it's like, how can we help people better control their healthcare conditions? And in this case, it was someone's life.
Yeah. And look, on the Medicare adherence space, there's a lot of competition. There are a lot of solutions that are out there. What type of research did you kind of go through just to kind of compare and contrast different solutions that were out there? And then, talk us through that process, because, I find that sometimes the most innovative solutions are the ones that are just very, very simple, but they're really difficult to get to. Walk us through the process of you trying to unwind solutions and see how you can kind of simplify them further. Were you trying to poke holes and why things didn't work? Like, take us through that.
Yeah. So the first thing was, I've always been really passionate about IoT and the Internet of Things, and kind of see a future where everything was connected. And this was at the same time where, I was, from the patient conversations that I've been having and just the diverse of patients that I was talking to, I was just like, how can we build a universal platform, a simple platform that works for all patients? And we've done some market research out there. There were the big pill machines, there the smart pill containers that had, like, it wasn't a flexible solution. And patients that are sick and need help with their medications could take anywhere, up to 20 medications, but they're using prescription bottles, they're using eyedroppers, they might have COPD and they're using an inhaler. How can we build a platform that works for all those types of patients? So when we're working with a clinical provider, they don't need a point solution for this, a point solution for that. Let's come up with a solution that can be a one-stop platform for all patients. And it was actually at the time, when I was writing this paper, I kind of in my vision had a prescription bottle and then one of those tiles that you'd have on your keys. And I started kind of playing around with it. and was like, oh man, this could really just go on to anything. Had no idea at this point that all the back end AI work that we'd have to do to actually make this what seems so simple, work so well. But that was really the point, and of kind of that single point where like, oh my god, wow, this could be incredible. So yeah, that's the story there.
Pretty interesting. I'm a huge fan of the tiles. I have to say that my wife tends to lose a lot of things, keys being one of them. So we have tiles on remote controls, channel changers, all things alike.
Yep.
So on this journey, where are you guys now? Take us through sort of the stage of where the company is, and then sort of maybe give us a peek into the next 6 to 12 months.
Yep. So we just raised our seed round led by HealthX Ventures. We closed that in December of last year. Since then, we've been really building off our momentum. We hired a couple of new people to really help grow and scale the product. Where we are right now is we are deploying into a couple sites in Texas where we're kind of looking at Medsense Health as a remote therapeutic monitoring solution. We're also deploying to a couple sites in the Philadelphia area, looking at Medsense Health from an assisted living and an independent living segment. And then where we're kind of going from there is just to continue to build off those successes, really want to, show, proven ROI in those segments, proven value for, patients, families, clinicians, pharmacists, and continue to kind of grow through those segments and make sure that we're hitting our, ultimate goal of, bringing this platform to hundreds of thousands and millions of people.
Yeah, before we kind of talk about RTM, maybe we just pause for a second because it sounds like you have a lot of momentum, and clearly, having had just different sidebar conversations with you, it hasn't been all glamour. Can you maybe get real for a minute and maybe kind of talk through some of the challenges that you guys have had to kind of to get through to get to this point, from a grinding perspective? I mean, it's great that everyone talks about innovation and how cool it is. The other side of innovation isn't necessarily spoken to about. Maybe can you get real for a minute here and just share maybe what some of those challenges are, even some of the challenges that you're facing today,
Yep.
and the ones that you've been through?
Yep. So I think one of the challenges when we first kind of had the idea for Medsense Health is, okay, we've got this great medication adherence platform. Now, where do we, what do we do with it? I think one of the big learning curves for us was realizing that we fit into a larger ecosystem of, let's say, virtual care. So how can we make our platform a piece of that pie to basically facilitate our entry into the market? Now, what I mean by that is we're not the first remote patient monitoring company. We're not the first virtual care company. Our customers are already working with vendors and partners. So how do we come in and work with them? So one of the big things we had to do was basically shift our product from being, a standalone, let's say, consumer product to being a platform that could be plugged in with our API and really be, a tool add-on for any existing virtual care platform. Now, again, that's great, but then we're at the mercy of, educating let's say, the virtual cares company's customer, to drive interest about integrating us. And then where do we fit in on their product roadmap that could be, 10 to 12 months down the road? How do we make sure we're growing our platform, growing our revenue? So that is one of the big challenges that we've,
Yeah, I mean, it sounds like you're in this conundrum where you know that there's a use case for it. You're trying to fit in seamlessly, and yet there's something that's outside of your locus of control,
Yep.
and it just there's friction points, and it's like sometimes it's a timing thing, and sometimes it's not having the right partner that wants to bring forth new solutions to their customers. There's always reservations. Are you, if they're the first ones, they want to make sure that things aren't
Mhm.
that things are seamless, that there's no issues. But show me a piece of software that where there never has been issues.
Yep.
It doesn't exist. There's always going to be some bugs. There's always going to be something, and it's just a matter of how do you kind of align and initially early on to kind of get through that. All right, so appreciate you being real there. Anything else that you think sort of stands out in your mind that maybe you guys have kind of grinded through? Maybe even on the product side, just because I know that that's something that you mentioned is very complicated and complex.
So yeah, so an interesting point would be, people think, oh wow, you put a sensor on your medication container. That's so simple. But when you're having someone that's taking 15, 20 meds and you have 20 sensors in an environment, how can you make sure that you're getting 100% of the data 100% of the time? And that's really important for just the accuracy rate, the readings, and if you're doing a B2B software technology platform, you need to be a highly accurate solution. So being able to basically operate in that RF heavy space to provide a great user experience is something that we did overcome on the product side, which was, you won't see it when you're using the product, but you will when you realize how great of a user experience it is, and making sure that we're monitoring those medications with near 100% accuracy to really provide real value to the patient and the clinician.
Let's talk about the sensors for a second, just sort of shift gears for a little bit. I mean, how long do they last? I mean, tell us, I mean, do you even have any that you can show? I don't know if you have any in front of you that you want to kind of
Yeah.
pinpoint.
So here's the sensor right here. People like to call it a poker chip. You just
Okay.
pop this onto any medication container, pull out this tab here, and you're looking at a battery life from anywhere from 1 to 3 years. So we can get up to like 15,000 different transmissions before the battery life dies. So it's great too. You stick it on, and if you need to change your prescription, you can just apply cross pressure, stick it on to the next one. Really kind of a smart stick on solution. One of the actually first names for this solution was like Stick RX. Luckily that name got axed to the better Medsense, but kind of an interesting first rev when you're kind of going through and thinking about what a cool name would be for your solution.
Very interesting. So for those that are sort of tuning in, I mean, is there any advice that you would kind of give someone if you have future entrepreneurs that are listening in, that are clinicians, that are working in a clinical setting, but are grappling with the idea of, man, what would it be like to sort of leave the profession and go into the entrepreneurial journey of,
Yep.
put yourself back to where you are now, but then going back to where you were when you first started. What's like any one golden nugget of advice that you would give someone?
Yeah, if you believe in your product and solution and believe that it can have an impact on patients, families, and providers, don't let the fear of rejection get in your way. Keep working day after day. You're in healthcare, it's going to be challenging. Everyone knows the sales cycles are extremely long. You're going to get pushback, you're going to get negative opinions, but you got to just not take anything personally and trust your gut and keep grinding and break through the barriers that are keeping you from your successes, and one day you'll be proud of what you've achieved.
Very cool to hear. So what's next for Medsense, and how can folks kind of keep track of what you guys are doing and the work that you're doing? Sort of maybe give a
Yeah.
little plug here for yourself.
Yeah, so you can follow us on LinkedIn. If you search Medsense Health, it'll pop right up. You can, I don't know, is it it's not a subscribe button for LinkedIn. I think it's a like or follow. But probably need to get that right terminology. Also, we just launched our new website. Really kind of shows what we've been up to the last year, kind of the platform enhancements that we've made, and also the markets that we're basically being able to make an impact in. And yeah, if you're interested in speaking directly with me, shoot me a LinkedIn request and message. I'd love to grab some virtual coffee with you and talk about ways we could work together. So it's been, again, Michael, thank you for having me on the show. It's been a pleasure talking with you.
Yeah, it's been good. I mean, look, at the end of the day, uh, it's just about getting real. It's about sharing with people the truth about your story. And I think the best innovators are the ones that have probably overcome the most challenges, that have gone through the most stuff. It's not to say that you still won't have doubts, you still won't have fear. It's about having good people around you that can help you push through that fear. So for those of you that are tuning in, we appreciate it. If you found this content helpful for you, please, would you mind sharing it on social media, on LinkedIn, even liking, the page for Medsense, even just liking what we're doing here with Advancing Healthcare Innovation Show. I'm grateful when we have a bunch of good people coming together trying to move healthcare forward. So look forward to our next conversation, Dr. Tabakin, and you're always welcome to come back.
Awesome. Thanks.